all that started well ended well. Thank you for making a difference. Thank you for making it count. We've just completed our second domain, and we have mentioned quite a lot from stress and stress management. We've talked about palliative care, what palliative care involves, survivorship, and of everything that regards the patient and the family. We've addressed them all, the emotional aspect, and getting to understand the pain that parents, families go through, and and even the grieving process, which I'll be going through, during the end of the fourth domain, during the completion of cancer, and I'll be doing a preview, several previews, like during the end of suicide. I'll be doing a review for those who lost their loved ones through suicide and understand the grief, how it works, and what to do, how to move on with life moving forward. And of course, being palliative care being the main objective of our second domain, palliative care is the care that is given to to individuals or patients living with terminal or chronic illnesses, cancer being one of them, and getting to know how it works, the key players of palliative care, and maybe if I may explain for them, we have the medical doctor whose work is to give the medication to patients, to follow up on the progress, that the medical aspect. So the doctor and the nurses, let's say the medical aspect, of course the nutritionist, what to eat, what not to eat, the spiritual guidance, the members of the religious leaders, can be the church, can be the Muslim, we don't know. And then there's the law aspect, so that their rights, they are not violated. And of course we have the volunteers and the caregivers, to maybe for those patients who require to be washed, to be helped to eat, for those who may not have really that movement, they are assisted along the way. So that is barely it, but there's a lot to mention, which I'll mention them in bits in the coming months, where I will do a preview, and where I'll also get to introduce a new sub-channel, where we'll talk only cancer. We will address what and the mental health of cancer, how do they come hand in hand, and of course we are going to mention suicide. Many people will take the easy way. How does this occur? So continue staying tuned, continue subscribing, share. We're going to find all this out in the process and lay it out for you the best way I can. So thank you.